Why do 90% of critical patients rely on mechanical ventilators? Let's find out. Mechanical ventilators are essential in modern medicine, especially in critical care settings. They provide life-saving support to patients who are unable to breathe adequately on their own due to various medical conditions. A mechanical ventilator is a sophisticated machine that helps patients breathe when they can't do it on their own. It takes over the work of breathing, ensuring that the body gets the oxygen it needs and expels carbon dioxide efficiently. It delivers oxygen into the lungs and removes carbon dioxide. This process is vital because oxygen is necessary for cellular function, and carbon dioxide is a waste product that needs to be expelled from the body. Without this exchange, the body's organs and tissues would quickly fail. There are two main types, invasive and non-invasive. Each type has its specific applications and benefits, depending on the patient's condition and the severity of their respiratory failure. Invasive ventilators use a tube inserted into the windpipe, known as an endotracheal tube. This method is typically used for patients who need long-term ventilation or are undergoing major surgery, while non-invasive ones use a mask or similar device. Non-invasive ventilation is often used for patients with less severe respiratory issues or those who need temporary assistance. Non-invasive methods are less intrusive and can be more comfortable for the patient. Here's how it works. The ventilator pushes air into the lungs, either at a set rhythm or in response to the patient's breathing. This can be adjusted based on the patient's needs, ensuring that they receive the right amount of support. It can also adjust the mix of oxygen and air depending on the patient's needs. This flexibility is crucial because different medical conditions require different levels of oxygenation. Why is this important? Proper ventilation ensures that the body's tissues receive enough oxygen to function correctly and that carbon dioxide levels are kept in check. Mechanical ventilators can mean the difference between life and death for patients with severe respiratory issues. They are indispensable in managing conditions like acute respiratory distress syndrome, ARDS, chronic obstructive pulmonary disease, COPD, and during critical surgeries. They are crucial in ICUs, during surgeries, and for patients with chronic conditions. In ICUs, ventilators provide continuous support to critically ill patients, while during surgeries, they ensure that patients remain stable under anesthesia. For chronic conditions, ventilators can improve the quality of life by providing consistent respiratory support. And that's the basics of mechanical ventilators. These machines are a cornerstone of modern medical care, providing essential support to those in need. Stay curious and keep learning. Understanding how these devices work can give us a greater appreciation for the technology that saves lives every day.